I'm Emily Campagno.
I'm Guy Benson.
I'm Shannon Bream, and this is the Fox News Rundown.
Friday, January 21st, 2022. I'm Chris Foster. Free coronavirus tests and masks are going out as hundreds of thousands, probably millions of Americans a day are getting infected with coronavirus. The surge has peaked in much of the country.
I think the beginning of the end is here because we've achieved a high level of vaccine immunity. And, everyone who doesn't have good immunity and even people who do are getting infected with Omicron.
We speak with Admiral Giroir from former President Trump's coronavirus task force.
I'm Jessica Rosenthal. He's Jesse Watters, and his world will now be a nightly show on Fox News at 7 p.m. Eastern Time. He says he has a plan to tap into what he calls a new grassroots movement of Americans who are over the existing power structure.
We're kind of sick and tired of being disrespected, of being lied to, of being manipulated for money, being divided for political power.
And I'm Jimmy Fallon. I've got the final word on the Fox News Rundown.
The Biden administration is having free, higher quality coronavirus face masks distributed to pharmacies and health centers, and free coronavirus tests will start arriving in people's mailboxes over the next week or so, more than 22 months into the coronavirus pandemic.
Should we have done more testing earlier? Yes, but we're doing more now. We've gone from 0 at-home tests a year ago to 375 million tests on the market in just this month.
The president at his news conference Wednesday. Infections continue to rise in more states than not, although many appear to be past their peak. White House spokeswoman Jen Psaki tells Fox.
You heard the president say, we don't want to live like this forever. We want to get back to a point where we're not wearing masks, of course.
Americans who want them are eligible for 5 free N95 masks per month from the government's strategic national stockpile. The free tests being mailed to homes, limited to 4 total.
500 million tests over 2 to 3 months, it's really not enough to make a significant impact. So it's really a drop in the bucket.
Admiral Giroir is former Assistant Secretary for Health and acting FDA Commissioner, also the coronavirus testing czar on former President Trump's coronavirus task force.
I think it's more for just the statement that he's doing it more than having a public health impact. Number 2, given the fact that we don't have enough, only 500 million over a few months, I really believe they should be strategic about that. In other words, be sending it to people who are at very high risk of hospitalization or death. Because remember, we have oral medications, pills you can take by mouth, that if you test positive, you can get on those, the earlier the better. So I would target them to high-risk individuals. The government knows who they are, right? They're all in the Medicare rolls. We know who has comorbidities. The final thing is I really have problems with the equity of this program because you get 4 tests per household. Now, I really have concerns because I don't have the national data, but I do know that some of the highest risk households have many more people than just 4 people or 2 people or 3 people. It's the multi-generational household that has the grandmother and the great-grandmother. These are at very, very high risk.
I mean, if this was the Brady Bunch, you couldn't even test all the kids. I mean, I don't know where they came up with 4. And another problem I've heard that there are people who live in multifamily homes who share an address technically, and whichever family signs up first locks the other one out. There's also the issue of people who don't have a fixed address who may need access to testing. What about the idea of distributing the tests the way they're distributing the masks now, where you just spread them out to every pharmacy in the country and make them, if not free, highly subsidized, where if you need the test, you can go in and get them for $1?
Yeah, the problem is we don't have enough, and that's the issue. As I see it, the Biden administration from January to September of 2021 really didn't invest in testing. They invested in some infrastructure around testing, but they didn't guarantee the market so that the manufacturing lines, the assembly lines all sort of shut down. And we saw the reports of even major companies destroying their home-based test because there was no market for it. They weren't doing that out of spite. The tests do have a shelf life, so you can't sell tests after they're expired. So now we're playing catch up. We really are where we are now. We should have been here in March or April of last year.
Well, something you mentioned was part of the White House defense of why now? Why what took so long? And they were like, look, there just wasn't a market for it. And I guess Omicron is, in their defense, part of why people are scrambling for tests now. Look, we're hearing numbers like 800,000 new infections a day, which speaks to how contagious Omicron may be. But is that number even relevant anymore? I mean, nobody's keeping track of these at-home tests, right? How much are we undercounting?
There are pretty good estimates about how much we're undercounting. So the real infections per day, and this is by multiple sources, good mathematical models that look at undercounting and a variety of other factors. We're having about 6 million new infections per day in the United States, and that has been that way for about a week. It will probably remain that way for about a week. We have certain states that are peaking and coming down now. About 20 states have peaked and are starting to come down. The rest of the states are getting close to that. But yeah, we're undercounting almost by a factor of 10. There are at least 6 million new infections per day. So you're exactly right. Some of them are home tests that don't get reported, and others are just mildly symptomatic or asymptomatic infections that no one, they think they have a cold or the sniffles or the sore throat. So they don't really go get tested. So, nobody knows, including themselves, that they have COVID. But it's a lot number. Omicron is very, very contagious, as we all know, even to those who have been doubly or triply vaccinated.
Yeah. I mean, and all those infections, of course, can lead to more and more infections. So I guess the case rate is relevant in that sense. But otherwise, we really probably should be looking at hospitalizations and deaths, of course, right? If we're talking about,
of course,
what kind of public policy we should be putting in place.
Yeah, of course, because hospitalizations and deaths are really what we're trying to avoid. If everyone in the country got the sniffles for 3 days and nobody got hospitalized or died, we wouldn't be worried about this, right? It would be a normal sort of cold season. But what we're really concerned about is in this last wave of Omicron is, although Omicron is much less serious than Delta or even the previous variants or even the native Wuhan strain, much less serious, we have so many infections that the rate, even though it's lower of hospitalizations, the actual number of hospitalizations are going up. And unfortunately, we know that mortality lags. So even if the peak of infections go down a little bit over the next couple of weeks, and I think they probably will, our mortality will probably remain high for several weeks, which is just an awful tragedy.
Yeah, I mean, even if it's pulling these numbers out of nowhere, but if Omicron is half as virulent but 5 times as contagious, you're obviously going to end up with more hospitalizations and more deaths. Now, look, there are models, and there's a wide range, that say we could see anywhere from 50,000 more to 300,000 more American deaths by the middle of March. Does that sound reasonable to you? Do you think we'll hit 1 million American COVID deaths? It's 850 something now.
Oh, we'll hit 1 million COVID deaths. Unfortunately, I think we're going to do that. It's just a matter of when. I am very hopeful. Predicting the future is very difficult, and this virus has proven an incredible adversary because of its tendency to evolve into some degree of evade immunity. I am hopeful that between Omicron and vaccinations, that we're going to have a large degree of population immunity, and we're going to see this go endemic at a much lower rate and at a much lower hospitalizations.
Yeah, I mean, one of the criticisms from people about the vaccines is, oh, well, look, they're still getting infected. Look at all these breakthrough infections, and you hear boosted people being infected once or twice more now. But you are trying to, I guess you would reiterate the fact that you do get protection from serious illness and death by being vaccinated and boosted.
Yeah, absolutely. You have good protection against serious illness and death from Omicron, even with just 2 doses of vaccine or a previous infection. But you can raise that protection dramatically by getting a boost. So a boost will raise your protection against hospitalization and death.
Another criticism of this administration and the one you were a part of is the mask guidance. It's changed over time. First, you don't need them. Don't worry about it. And then, okay, cloth is fine. Now people are strongly urged to use N95 masks or the equivalent. I mean, the defense there from scientists is that, well, the virus, what we know about the virus is changing, but the CDC is still accused, from 2020 to now of muddled messaging. How would you have suggested improvements there, even if it's in hindsight?
Well, I think the messaging was certainly muddled. I do believe the advice way back in March in 2020 in the Trump administration, when, particularly Dr. Fauci said, don't wear masks, they're not helpful. That really wasn't the case. We didn't know whether they were helpful or not. There was a shortage of them. And I think you should be straight with the American people, just saying, look, we don't know if they're helpful or not, but we have to preserve them for the healthcare workers. I think that should have been the message. So I think it was muddled then. In all fairness, until Omicron, wearing a mask provides some protection, right? Even the cloth mask. And we know that. It was not perfect, maybe 25 or 50%, but there's no silver bullet. It helps by layering protection. When Omicron hit, And I want people to understand it's a fundamentally different disease. It's still COVID and it's still a variant, but it is highly respiratory transmitted in very small particles, which is one reason why you see the number of cases. So for Omicron, it seems pretty clear that certainly the single layer cloth masks are not very effective. If you want to protect yourself and others, you need to wear a well-fitting mask, and that's preferably a surgical mask or an N95 or a KN95. That is, Omicron is different. It's not because we messed up the science or we didn't have the messaging, but people have to understand that Omicron is a different beast compared even to Delta.
At what point, other than maybe some hotspots here and there in the country, at what point are we living with no restrictions going back to late 2019?
There's not an on or off switch, right? There really isn't. But, we're going to see this gradually transition. And I think the beginning of the end is here because we've achieved a high level of vaccine immunity. And, everyone who doesn't have good immunity and even people who do are getting infected with Omicron. And Omicron does provide a strong natural boost to your immune system. We're in the midst of a very bad outbreak now, but I can tell you that in many parts of the country, mobility is not down very much. I go to the grocery store, I go to college basketball games. I think, for people who've been vaccinated or who've had previous COVID, the risk of Omicron is very low. If I were 85 years old or I had cancer or I had multiple sclerosis or some other, comorbid condition, if my BMI was 45, I'd be really concerned. And I think those people are going to have to be concerned into the future. But for the great majority of relatively healthy people who've been vaccinated or who have had COVID, or preferably, even if you had COVID, getting vaccinated, then you're sort of super immune. I think we could go back to relatively normal society.
Former Assistant Health and Human Services Secretary Admiral Brett Giroir, also a medical doctor. He was the coronavirus testing czar in the Trump administration once the pandemic got started. Admiral Giroir, thank you very much for talking to us.
Really appreciate it.
This is Jimmy Fallon with your Fox News commentary coming up.
For several months, you've seen several hosts fill the 7 p.m. Eastern primetime slot on the Fox News channel. Some well-known Fox personalities, and some you may have gotten to know better, who may have been panel guests or contributors prior. But the hour has a new permanent host with an eponymous title, Jesse Watters Primetime. You may remember first seeing Jesse with his Watters World Man on the Street segments for years.
It gives kind of the power back to the people.
That's the opposite of socialism.
Is it really?
You're putting me on.
So you want to make the rich less rich? Sure, yeah. Equality?
Damn it! Who typed a question mark on the teleprompter?
Has a poor person ever offered you a job? They have not.
Watters ended up as a co-host on The Five, which airs at 5 p.m. on Fox News.
Democrat governors want to fight tooth and nail to regulate their own gun laws, their own state taxes, the way their COVID regulations are.
He will remain on The Five, but he's moving on from his Saturday night show, Watters World. We talked with Jesse about what we can expect each night and what he plans to bring to viewers that is uniquely his.
My brand is my connection to the audience. How I established that connection on The Factor, traveling the country, mixing it up with all kinds of people on the street. So I'm very tapped in to what the people want, who they are, and what makes their heart beat. So I'm going to keep that in mind for every single show. Why do the people need to know this? How are the people feeling emotionally about what's going on in the country? And how can we together come together and move this country in a better direction? And so the show will be unpredictable, and we will be introducing new types of segments, new guests you haven't seen before, but also establishing some consistency with some of the guests that you'll see on a regular basis that I have great chemistry with. And one day we could be doing something about food. The next day we could be doing something about nuclear submarines, and the next day we could be investigating Kamala Harris's nighttime activities. You never know what you're going to get on prime time, and that's what I think that people should expect. Expect the unexpected, but we're going to be keeping it real, as always.
Is that what you think got you the slot? I mean, we've seen a lot of different hosts for months in that position, and it was fun, right? You got to see a variety of takes. You got to see people more in depth who you might have seen as guests on the channel. And I'm just wondering what you think it was about your magical self that got you the slot.
Well, I mean, I could go on for hours. I don't know if we have all that time, but one of the things that, and just not talking about why I got this, but one of the things that I do and maybe could be unique is that I have a smile on my face, and we cover the news accurately and honestly and with a lot of passion, but at the same time, we'll have some fun with it. And no one says the news has to be boring. We're definitely going to make some of these segments dance and pop, and you'll love that, and you'll get used to that. But I really think, I'm not going to go out there and have it be a rage fest, and it's not going to be boring. It's going to be fun. It's going to be uplifting, informational. Definitely going to learn something every show, but it's going to be, we're going to be positive, and we're going to be going in the right direction.
Yeah, I don't want to call it a smirk, and I don't want to call it a Mona Lisa smile, but it is this sort of like I know when I see you, you're not. It makes me wonder. Do we take things too seriously sometimes? Like, is that smile your way of saying, okay, yeah, we're going to talk about this, but let's take the outrage down a notch?
Well, I don't get outraged a lot. And when I do, you'll see that on the show. And that's when I mean it. I'll be tearing people's faces off when I think they deserve it. But, I'll calm down and listen, we live in a great country. Life is great for the American people compared to the rest of the world. We have freedom. We have a lot of wealth here and a beautiful, beautiful country. So things might be tough now, and they are tough in terms of gas prices and inflation and crime. And I get that, and I'm in touch with that, and we're going to talk about that. But it's going to get better, and because it always gets better. And it's going to get better because we're going to get out of this thing by shooting straight and making it work. And I know everybody's going to do that their own way, right? Like, you got to change the country. You got to change your heart first. We'll change hearts and minds on primetime. I guarantee it.
People who watch Fox probably already have a feel for your brand and your delivery. I would think just not from the Saturday night show, but the 5, which is popular, obviously, in its own right. When you go out and about, what do you hear from people about you? Do you get ever like an airing of grievances, or is it mostly fans, or is it like a weird stare where people are like, where do I know him from?
All of the above. I go, obviously I'm out here in Manhattan, so it's a liberal town, right. But you'd be shocked to know how many conservatives live in Manhattan, how many Fox viewers are here. Sometimes they'll come up to you and whisper, hey, I really like your show. And other times it's Watters, they love it. And, I went out the other day and I shot a package, which you're going to see the first night. I'm a little man on the street, just asking people what they think of primetime, what kind of guests they want to see, what kind of news they want to see covered. And the number one thing that people want me to talk about was crime. And it was black, white, male, female, transgender. And literally everyone I talked to mentioned crime as something they think is a huge issue that they want to see discussed on the news. And, just being able to get out there in the street and know people and feel it, touch the energy. I think that gives me advantage that a lot of people don't have, and people know me like that. They're friendly, some not so friendly, and you'll see that also on the package on Monday. Got some screamers, but we like that. We embrace the hate on primetime because it's humorous and it makes me stronger.
That's good.
It is good, isn't it? It is good.
To let it make you stronger and not get down or defeated. Yeah, I don't know if there's a better word than good, but yeah, it is good. I remember I was out and about. I'm an MOS, man on the street gatherer myself. When I've gone out, it used to be, maybe at the end of the interview, outside the coffee shop, somebody would be like, hey, what's this for? Who are you? And now people are more suspicious. I get that question more like off the top. Like, who are you? What do you work for? What is this for? Do you think people have become more savvy news consumers? What is that about?
Yeah, I've noticed that too. It used to be, and it still is, depending on where you go. Just people, if they see a camera, they'll just come right up to you. They don't even care what the topic is. They don't even ask what the topic is. They just say, let's go. I want to be on TV. And those are the people you want, really. You want really honest people that don't have any guard up. But no, people are suspicious because they've seen how deceptive television can be and print journalism can be, and the editing, the way the words are twisted, the agenda. Obviously everyone has an agenda. And I think if I could give people advice, be cautious when journalists, so-called journalists, approach you with a camera and microphone, because you're at their mercy unless it's live. And so just be cautious, except when you see me. Don't be cautious.
Right.
Just run right up to me, or when they see you.
Jesse, people, as you know, often blame the media, rightly or wrongly, for how divided things feel. And I think everyone in this business, is participating or engaging, some in a bigger way than others, to the national discourse. And we all have some responsibility in this business for what we say and what we put out there. You kind of addressed this earlier, but what do you think of as your role in this time? Because it does feel like an important time, right? I guess history will tell, but we just went through this pandemic. A lot has happened politically. How do you feel about your role and what it is in the discourse?
The country's been disrespected for many years, from when we let China into the WTO and we sent all the factories elsewhere, to the Iraq war, which was just a meat grinder. Afghanistan, another meat grinder. People coming back, lost limbs, opioid crisis. We haven't even really focused on that. To, people pouring across the southern border, driving down wages, to the Great Recession, to this crazy pandemic, the Russia hoax. We've lost a lot of trust and faith in experts and our political leadership, and they've made no effort to regain that trust. If you question them, they'll censor you. They'll call you a conspiracy theorist. So this is where we are right now in the country. We're kind of sick and tired of being disrespected, of being lied to, of being manipulated for money, being divided for political power, the race card. They play the class warfare game constantly. We're tired of it. And you can feel a new grassroots movement arising, whether it's parents upset at school boards over CRT or school closings. You can feel parents mad in the inner city about, the lack of action on crime. People feel like their dollar's been destroyed when they go fill up, when the shelves are empty. So we're going to tap into that because we feel it. We feel the disrespect, and people are starting to regain their footing and look at the FBI, media, the White House differently than we used to. So they have to remember that they work for us. It's not the other way around. And we're going to start cleaning house and putting people in charge that represent us and that are responsive to what we want, because that's what this country's founded on. And that's going to be my mission on Primetime, to get us back to that place. But, we're not going to be vicious. We're just going to be honest and hold people accountable and try to tell the truth every single night.
Jesse, finally, I have to ask about your mom, because I loved on the 5 when you would share her texts from time to time. I think it's safe to say she's more liberal than you are. Are you going to share some of her thoughts about your show, or is Mom kind of tired of the spotlight?
Well, Mom is going to stay on the 5. Mom Text is a 5 property. But what we're going to do, and I think I haven't told people this before, but, my mom gets a lot of action. She gets to text me whenever she wants to be in touch with me. We're going to let everybody text me now. So we're going to set up a number where the country can text me. Not just my mom, everybody in the country can sound off about the show, about whatever they want. And we're going to have a conversation. We'll put some of their texts or their emails or however they communicate up on the back half of the show. And we're going to be in touch with the people. And that's what this is about.
Jesse Watters, thank you so much for your time.
Thank you so much.
From the Fox News Podcasts Network. In these ever-changing times, you can rely on Fox News for hourly updates for the very latest news and information on your time. Listen and download now at foxnewspodcast.com or wherever you get your favorite podcasts. Rate and review the Fox News Rundown on Apple Podcasts or wherever you listen.
It's time for your Fox News commentary.
Jimmy Fallon.
What's on your mind?
So a new study finds that 1 in 20 people have contemplated suicide because of politics. What it doesn't mention is that they were watching The View at the time they thought about it. I kid, but this study is no joke. Researchers found that 40% of Americans find politics to be a major source of stress in their life. The vast majority of them happen to be college students. This one blows me away, because when I was in college, we weren't concerned with running the country. We were concerned with running out of beer, which might explain my grades. The study shows that people are just as stressed under Joe Biden as they were under Donald Trump. And here's why. Politicians have always fought for power, but these days we spend way more time fighting along with them because of social media. Politics in this country have become a super stressful team sport that has us rooting for our party over our country because of Twitter and Facebook. Yeah, that's the bad news. We've all gone nuts. But the good news for all you stress strugglers is America's going to be fine because we've been through much more divisive times than these. No, this ain't the Civil War where we're going to settle things by picking up guns. We just need to put down our phones. Be sure to listen to Fox Across America with me, Jimmy Fallon, weekdays from noon to 3 on the Fox News app or foxacrossamerica.com.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. From the Fox News Podcasts Network, download and listen to Tyrus and Timpf. Every week, Fox Nation host Tyrus and Fox News contributor Kat Timpf give their hot takes, explore weird headlines, and share amusing stories. Subscribe and listen now by going to foxnewspodcasts.com.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.